Welcome everyone, and thank you for joining us for today's educational webinar, Beyond Surgery, Living a Full Life Post-Heart Valve Disease Treatment. Today I'm joined by Lorraine Montoya, an advanced practice nurse, as well as Jacqueline Little, a primary care nurse practitioner, and John Stott, a heart valve patient. I'm Ellen Ross, the Managing Director of Heart Valve Voice Canada, and I'll be moderating today's session. Just a little bit about Heart Valve Voice Canada. We are a not-for-profit organization whose mission is to educate and advocate for early detection and diagnosis, along with innovations and treatments so that Canadians with heart valve disease get the best possible care over their entire patient journey. Today's webinar was designed for you, patients and caregivers, so that you learn what considerations to make prior to a heart valve procedure, and to understand what to expect in terms of the preparation and recovery from this procedure. And we'll also talk to you about resources and tools to aid in the recovery process. And now I'd like to turn it over to Jacqueline Little to talk to you about what to expect prior to your heart valve disease procedure.
Thank you, Ellen, for the introduction, and hello, everybody, and thank you for listening today. As Ellen mentioned, my name is Jacqueline Little, and I have been working in nursing for 20 years now. I have an extensive background in cardiac nursing, specifically in intensive care cardiac nursing, and 5 years as a minimally invasive care coordinator at St. Michael's Hospital in Toronto. Since 2019, I have been working as a primary care nurse practitioner in the community setting with clients that have highly complex medical needs, including mental health. Next slide, please. So this part that I'm going to be discussing is about preparing for your heart procedure. And hopefully I'm going to bring you some clarity on what to expect in the leading weeks and days prior to your heart valve procedure. Next slide, please. We've separated different heart valve procedures into two groups to simplify it. There are many different types of valve procedures, some of which are done by open heart surgery, and you can see one of the columns here discusses open heart surgery. Open heart surgery means that you're going to have a sternotomy, and a sternotomy is a procedure that allows your doctor to reach into your heart and the nearby organs and blood vessels there. This is an opening in the breastbone of your heart, of your chest, and this is fixed and by wires, and this can be part of the recovery time, which we're going to discuss further. Minimally invasive and transcatheter surgeries are either done through small incisions in the ribs or small puncture sites in the groin area. They include transcatheter aortic valve implementation, also known as transcatheter aortic valve replacement. And you'll hear these words, if this is your procedure, you'll hear these words used interchangeably, but they mean the same thing. Mitral clip, valvuloplasty, and minimally invasive aortic valve replacement are all procedures that can be done through the puncture site or through a small incision through the ribs. Next slide, please. Other words that you're going to hear prior to your surgery used are elective and non-elective. And this is important because it deciphers the difference between your surgery being an immediate medical emergency and a surgery that can be scheduled. An elective surgery is a surgery that's scheduled in advance. It's important to understand the difference between these two. If you're having a non-elective surgery, you'll likely know because this is usually something that's planned urgently. And it's something sometimes you can go from having an elective surgery to a non-elective surgery. If you're at home with a scheduled surgery date and your symptoms change, you might need to go to the emergency room, at which time your surgery might change to a non-elective surgery. And we're going to talk a little bit about changes in symptoms in the next coming up slides. Next slide, please. Things you can do to prepare for your surgery from a physical aspect. So these are important because you might have things like driving limitations. Your doctor, your family doctor, your cardiologist, or your heart surgeon might recommend that you don't drive, especially if you have aortic valve stenosis. It might be recommended that you don't drive. It's important to discuss whether or not you should be driving while you're on a wait list for your surgery. Obviously, eating healthy is something we should be doing as a lifestyle change, no matter whether you have heart disease or not. But eating healthy prior to heart surgery is very important. Specifically, your doctors might recommend that you need to reduce the amount of liquids that you have, or that reduce the amount of salt. And obviously, taking the medications that your doctor has prescribed for you is very important. Seeing your dentist, we're going to talk a little bit about dentists, but it's important prior to the procedure that you see your dentist, especially if you haven't had any dental visit within the last 6 months. There is a length of time where you can't see the dentist after your heart surgery, and my colleague's going to talk about that in the coming up slides. So important to see your dentist prior to your surgery. Staying active is very important, even if you have heart valve disease. It's important to understand your limitations. It's important to still get exercise if your doctors recommend it. Health Canada guidelines say we should be having 150 minutes of exercise. If you have heart disease and you suffer from symptoms, if you have heart valve disease and suffer from symptoms, just being aware of your symptoms and changes. If you're doing an activity and you get short of breath, chest pain, or feel faint, it's important to listen to your body. And be aware of changes, but still get exercise as long as it's recommended. Next slide, please. So symptoms. So this is what I've been mentioning a little bit, is noticing those small changes and the sudden changes. Small changes might be that you just feel a little bit more tired. They might be something that you just feel more gradually. You might feel just a little bit more short of breath as the days go on, more fatigued at times. Sudden changes are extreme short of breath, not being able to walk a couple steps, and an extreme change from just feeling slightly tired or slightly short of breath to suddenly not being able to walk a couple steps. Needing more pillows when you sleep is always a sudden change as well. You might be sleeping with one pillow and suddenly need 3 and you need to sit up. Those would be symptoms that you need to discuss with your family doctor, cardiologist, cardiac surgeon right away. And weight gain, monitoring your weight. You might be asked by your doctors to monitor your weight. And this is related to congestive heart failure and gaining weight because the heart's having a more difficult time pumping. Next slide, please. So symptoms. So we have a symptom tracker at heartvalvevoice.ca. So you can go to our resource page and check out our symptom tracker. And this is such a great tool to use to keep track. Sometimes it's hard to remember, was I this short of breath a week ago? And it would be easier if you can go and gauge those symptoms, whether they're mild, moderate, severe. Maybe you had none at all, and now you're finding it to be more moderate. That might be a more severe, sudden change that you need to notify your doctor. So this is a really great tool to use to monitor all your symptoms. Also also at the bottom, you'll see there is not just physical symptoms we're having, but the mental health symptoms that we're having, the anxiety and depression. Maybe this is something you suffered from before, so it's important to notice any changes. If you're feeling more anxious as the days leading up to your surgery, that is completely normal. Stress is also a big part when it comes to a heart surgery. So monitoring how you're feeling leading up to the days. Thank you. Next slide. Planning ahead and going home. So these are pieces that's so important to do prior to your surgery. So planning ahead for patients and caregivers, questions you want to ask yourself is, number one, how are you going to get home from the hospital? And what type of help are you going to need at home? That's very important. What are you going to do for meal preparation? Can you start preparing meals now? Can you freeze meals? Do you have a support system in place? Do you have a neighbor that can check on you? Or maybe going into a retirement home respite for 1 to 2 weeks might be something that is more suited to your needs. So asking yourself and your caregiver, having those conversations and asking those questions is an important part of the planning. Also, sometimes we don't always like to think about it, but advanced care planning is very important, and having that conversation with our family and friends and our support system. It's difficult to talk about it, but sometimes we need to have these conversations about what to do if our health worsens, what to do if we're in an ICU and we can't speak for ourselves. Our family needs to know, and our friends need to know what our wishes are. Next slide, please. And then a lot of people always want to know, what's the length of time that what I'm going to be admitted for? That depends on so many factors. It depends on the type of procedure. It depends on the result of your procedure. It depends on the plan you had in place for going home. It depends on your individual care needs and your overall general health. Some people have different needs. Maybe they're on dialysis, and so their general health is going to be much different in terms of the length of time that they were admitted for. What we do know, though, and what we've done many studies and research on, is that people recover faster if they don't stay in hospital longer than needed. So getting home as soon as you're fit and able, and as soon as the doctors think you should go, is most important. Next slide, please. Goal setting. Goal setting is always important, and thinking about these goals prior to going to surgery. Where do you see yourself in a week, in days after the surgery? What are your goals? What are the long-term goals? Where do you want to be in a couple months? What type of quality of life do you want to get back to that maybe you haven't had while you've had your heart valve disease? Maybe you've been really suffering from shortness of breath and you haven't been able to walk a couple blocks. Maybe your goal will just be to go for a longer walk with a loved one. Those are goals you can start to think about. Maybe you want to get back to golfing. All sorts of different goals you can set for yourself, but thinking about them from just days and then weeks to months, and making sure your goals are achievable for you. Sometimes when we don't get to our goals, or when we set unachievable goals, it can be very disappointing. So thinking of goals that are achievable. And being cognizant, sorry, I paused. So being cognizant of our age and the pre-existing factors that might contribute to our goal setting. Next slide. So this slide is mostly just a summary of everything I've just discussed about the planning and the recovery and our daily life and our daily activities. So it's really important. I'm just going to kind of wrap what I've just talked about up here, anticipating needing to get more help with our regular activities of daily living, and what that help's going to look like, and who can bring that help to help with our physical and everyday life recovery. And as I mentioned before, whether or not you need to be in a kind of respite care, or starting that organization and planning not to drive, getting healthy meals and groceries, and then making sure we're engaging our primary care practitioner, whether it's a family doctor or nurse practitioner, for the resources that might be helpful, whether it's Meals on Wheels or other resources that might be helpful for us. And our emotional and mental health recovery is incredibly important. Each person's journey is unique, and later on you're going to hear from one of our patients, and it's really important to understand that each person is going to have a completely different recovery journey. But things we can do for our emotional and mental health prior to surgery are engaging in some grounding activities and practices. It's really important that we practice these things when we're feeling calm, because when we're feeling stressed and anxious, we can't engage in calming activities. So practicing these things prior to surgery. I give an example here of box breathing, and box breathing is just a very simple breathing technique that anyone can do, and it's really important to practice this prior to surgery. Box breathing is when you take a big breath in and then you hold it, and that's the line going across the top of the box. Breathe out, that's the line going down. Hold it, that's the line coming across the bottom. Breathe in and hold, and just imagine drawing a box with your breath in, hold, out, hold. It's a really simple breathing exercise that everybody can do, and remember to practice in times of calming. You can look up all sorts of grounding practices to manage anxiety and depression as well. And we also gave a Crisis Service Canada number here. If you ever are in a mental health crisis, you can call or text this number for help. Thank you. Next slide. Lorraine is my colleague, and she's going to talk a little bit more about procedure, during procedure and after procedure. Thank you.
Hello, everyone, and thank you very much for coming to this webinar. My name is Lorraine Montoya, and I am a nurse. Up until a few years ago, I worked with heart valve patients at the University of Ottawa Heart Institute in Ottawa. My main job there was to support patients who were waiting for their heart valve procedure, and then to help with any concerns around their recovery after they were discharged home. What I learned along the way was that preparing for the procedure, knowing what to expect, and having a good plan in place were all really important factors in facilitating a smooth recovery. Next slide. So I'm going to spend a little bit of time talking about what to expect during your procedure. Next slide. If you're having a planned procedure, so that is elective, whether open heart surgery or a more minimally invasive procedure, you will have had some blood tests done, maybe a couple of x-rays, other pre-admission preparations. Different hospitals have different routines, and some you're admitted the day before your procedure, and others you are admitted in the morning of. Make sure that you understand what the processes are at your hospital, where you need to go, and when. Before any procedure or surgery, you would have also been required to not eat or drink after midnight. But it's really important to check with your doctor or nurse about which medications you should take and which medications you should hold off on. During the pandemic, while elective heart procedures are still ongoing, the ability for family members to accompany you to the hospital or to be there immediately after your procedure is a bit restricted. It's difficult not to have that support, but I want you to be assured that your doctors and nurses will make sure that your family is updated regarding your condition after your procedure and your progress as you continue to recovery. So once you're in the operating room, depending on the procedure again, you will have either a general anesthetic or an intravenous sedation medication. In both cases, you'll be asleep throughout the whole procedure. After the procedure, if you're having a minimally invasive or transcatheter route, you'll go to a specialized recovery area or a coronary care unit. After cardiac surgery, you're usually taken to the intensive care unit where your heart is very closely monitored along with all your other vital signs. Next slide. So I want to talk a little bit about elective versus non-elective or urgent. The experience of requiring an urgent heart procedure is more challenging for both you and your family. Sometimes heart valve problems come out of the blue, and sometimes you're aware that you have a heart valve condition, but it has been stable. Currently during the pandemic, but sometimes even when there is not a pandemic, some people have been reluctant to go to the emergency department or to see their doctor. But if you're having new or worsening symptoms like sudden weight gain, shortness of breath, and all those other things Jackie was speaking about, it's really important to just go. Also, it's important to be aware of your symptoms, what they might mean, keep track of them, use the symptom tracker that Jackie mentioned earlier, and keep in touch with your doctor. Next slide. So I'm going to talk a little bit about the afterwards, after you've had the procedure. Next slide. So after open heart surgery, if you speak to someone about who had open heart surgery weeks after the procedure, they will often tell you that they have no memory of being in the intensive care unit. However, many people do remember, and it can be an uncomfortable period of time. You will be connected to equipment that is monitoring your heart and your vital signs. You'll have intravenous lines. You may have a catheter in your bladder to drain the urine out. You may, when you wake up, still have a breathing tube inserted, which means that you won't be able to speak. But once you're breathing well and on your own, that tube will be removed. Additionally, you will have dressings and possibly drains in your chest. And finally, because of the anesthetic and other medications, you will likely feel quite groggy. Expect to feel some level of pain or discomfort. And the problem with feeling pain or discomfort, besides the fact that you're feeling pain or discomfort, is that it prevents you from taking deep breaths and from moving around. And these are the things that are really important to get your recovery started. So it's important to ask for pain medication, especially during the first 24 to 48 hours after your surgery. As early as possible, the nurses and physiotherapists will be encouraging you to sit up and as soon as possible to start taking a few steps. Most people, after 24 to 48 hours, will begin to feel better sitting up. Many of the tubes are gradually removed, and finally, you'll become stable and be able to be moved, and stable enough to be able to be moved to the regular ward. For some people, however, the first few days after surgery can be complicated by episodes of delirium or confusion. Postoperative delirium is a type of confusion that occurs suddenly and can cause patients to become restless and anxious. Some can experience hallucinations. Some can go through periods where they do not even recognize their loved ones. It's usually caused by a combination of factors such as your anesthetic, other medications, disrupted sleep patterns, heightened noise in the intensive care, pain, and so on. Prolonged episodes of delirium like this can lead to other complications that might end up having to stay in the hospital for longer than originally anticipated. For people experiencing postoperative delirium, it's important to get up sitting, to get back to normal sleeping patterns, to manage your pain and discomfort, and when possible, to start seeing familiar faces or objects. In my experience, it's often been equally distressing for both patients and family members to go through this. So it's important to speak to your doctor and anesthetist beforehand about your risk of developing delirium and any preventative steps that can be taken. Next slide. In general, after minimally invasive or transcatheter procedures, your recovery is more predictable and generally easier to manage. Immediately after your procedure, expect to wake up in the coronary care unit or a specialized recovery area. The priorities during your recovery will be monitoring for any complications, taking lots of deep breaths, and just making sure you're progressing as expected. After transcatheter procedures, you'll have to lie flat for a few hours to ensure there's no bleeding from the catheter insertion site. This is important, and so the staff will be checking on you and reminding you to lie flat. But this can be difficult, and many people find it difficult to lie flat for prolonged periods. It becomes uncomfortable, and it can be really difficult, but at the same time, it's a really important part of your recovery. So if you find that you're kind of suffering and you try not to move around too much on your own, just ask the staff for help. They can either help you move a little, or they can make sure you get some pain medication so that you can feel a bit more comfortable. Depending on your progress, You'll gradually increase your activity level, beginning with sitting up in bed, then in a chair, and then walking, and so on. Next slide. So going home after minimally invasive and or transcatheter procedures is usually faster than having surgery. During this time, it'll be important to monitor the small incision or the insertion site for any signs of infection or bleeding, such as swelling or redness, oozing, or any other sort of new features that are happening. Before going home, make sure you understand any changes in your medications. While going home quickly is really great, it can also mean that we can set ourselves up for one of those hit the wall type moments. So keep track of your recovery. Increase your activity gradually. Don't overdo it. I've had many conversations over the years with patients who initially felt great and started and really just went overboard, right away. And then they end up sort of having this, where they've got nothing left. So just like, it's one thing to have your heart valve fixed, but you really have to remember that the rest of your body kind of has to have time to catch up. So you need to take this recovery period slow. Having an open heart procedure will require that you stay in the hospital for a little bit longer. While you're recovering, the focus will be on monitoring your recovery, watching for complications, making sure your surgical incision is healing properly, and preparing for your discharge. Before going home, make sure you understand what you can and cannot do. For example, even though your breastbone incision has been repaired with surgical steel stitches, it will, like any bone break, require up to 8 weeks to fully heal. This means that you cannot lift, push, or pull anything heavier than 10 pounds. Also, make sure you understand your medication prescription. It may be different than what it was before. The first few days or weeks after recovery can be stressful for both you and your family because sometimes it's hard to know what's normal and what's not normal. Is the pain from your surgery site, or is it heart pain? Is it chest pain? Are you tired because you had surgery, or is it because something else is going on? Are you feeling mentally foggy because of being on a bypass machine during surgery, or are you having a stroke? It's really normal and natural to feel anxious, tired, moody. Just make sure you have a number, either of the hospital or of your surgeon's office, where you can call and ask questions. And really, no questions are too small or too big. And finally, and this is really important too, your pain medications combined with lower activity levels, altered eating patterns, and so on will more than likely leading to you becoming constipated in those early days after your surgery. And as banal as that may sound, constipation can lead to discomfort and unnecessary complications. So besides moving around and gradually increasing your diet, make sure that you have a gentle laxative at home that you can take should you run into this. Next slide. Over the long term, you will gradually begin to feel better and get back to normal. When you think about it, the overall purpose of having a heart valve procedure is to get you back up to living your life at the highest quality possible. But the heart valve procedure is only part of that puzzle. And while it's, of course, the biggest part, on its own, it's unlikely to fulfill your goal. So what else needs to be done? We know that physical activity is foundational to good cardiac recovery, and for people who have had a heart valve procedure, a cardiac rehabilitation program is the best way to help you safely and confidently start a physical activity program that is tailored to you. Cardiac rehab programs come in all shapes and sizes. Some are on-site programs, some are telephone or virtual based, some are small group, some are individualized, but they all have the same goal, which is to help you to regain strength, reduce your risk of future heart problems, and to improve your health and quality of life. Cardiac rehab is not just about increasing physical activity, it's also about learning how to conserve energy, eat healthy, manage your medications, and so on. Along with your surgeon and your other healthcare providers, the team in cardiac rehab can help with planning your return to work and other everyday activities. And finally, during this phase of recovery, you can also get other kinds of counseling and support as you meet the challenges of getting back to feeling confident about managing this journey going forward. Expect to have 1 or 2 follow-up appointments with your surgeon during this recovery period as well. Once you're physically healed, your regular doctor or other healthcare provider will take over with your overall care. It's important to ask questions about going back to work, driving, and resuming sexual activity. These are individualized decisions that will depend on guidance from your surgeon and other healthcare providers, as well as how you feel and how well your recovery is progressing. Finally, after a heart valve procedure, you will always have to take antibiotics before any kind of dental work. And why is that? And again, this is important. So during dental procedures for anyone having a dental procedure, there's always a risk that bacteria that's in your mouth can enter your bloodstream. If this happens, the bacteria is quickly identified by the immune cells that are in your blood and destroyed. However, if you have had a heart valve implant, the bacteria can lodge itself on the new heart valve and hide from your immune cells. And this can lead to a life-threatening condition called endocarditis. So whenever you're planning a dental appointment, remind your dentist that you will need a prescription. Dentists know all about this and will know exactly which antibiotic to order, along with the proper dosage instructions. Next slide. So this would not be a heart webinar without a slide about heart-healthy lifestyle changes. We know that regular physical activity is the cornerstone of long-term recovery. It doesn't matter your age or your abilities. It's about regular movement, strength, flexibility. It will help you have more energy, sleep better, improve your mental health, and make daily activities easier. Diet and nutrition, including if you're diabetic, making sure your blood sugar is stable, is also vital to improving and maintaining your quality of life. Keeping track of your medications and making sure all your healthcare providers know about all your medications is also important. Many people after heart valve procedures have to take a blood thinning medication. It's important to take this medication exactly the way it's prescribed and to understand and prevent possible complications or side effects from it. We always tell patients to have all their prescriptions filled at the same pharmacy. That way the pharmacist, who knows about medications, knows which medications interact with other medications and so on, will know exactly what you're taking and will be able to better help you manage this, again, really vital part of your care. Anyone who receives a new heart valve will eventually get a card from the valve manufacturer, which details exactly what valve they had, the serial number, and so on. It's important to keep that card with you at all times. It's an important communication tool. It's also best to keep an accurate list of your medications as well as your surgery details and so on with you at all times. Because in situations where you may not be able to communicate, this information will then be immediately available. Keep in touch with your healthcare team. I know that sounds silly, but again, sometimes our healthcare can be fractured. One specialist here, another there, a physiotherapist for back pain, a dentist for our teeth, maybe an orthopedic doctor because we slipped on the ice last year. You know, all of these are people know different things about you, but they don't know the whole picture. And in the end, we're the only ones who know everything about ourselves. And we're the best ones to be ensuring that everyone knows our story in its most accurate and up-to-date format. And the last thing I want to say, and I'm going to sound like a nag here, but if you smoke, quit. It's hard to do. It will likely take several attempts and you will be grumpy. But do it anyway, because there's nothing kinder that you can do for your body and yourself than this. So I'm going to pass the baton over to John, who can give you a first-person account of the experience of having surgery. I've learned a lot from John's wisdom and experience, and I think you will too. Thank you.
You're on mute, John.
There we go. Okay, thank you, Lorraine, and thank you as well, Jacqueline, for those really insightful, helpful hints and observations. I wish I'd had the opportunity to hear them before my journey began. Hi, everyone. My name is John Stott, and like a lot of you, I am impacted by heart valve disease. I'm a patient. So I thought it would be helpful to share with you today my journey, and in hopes that it might help you with yours as well. I'm a recently retired human resources director, and I remember growing up finding sports fun and relatively easy. So I took health a little bit for granted. Looking back on it, though, I find that I actually did better in sports that required excelling in both strength or coordination, and not so much for stamina. But like a lot of young people, I thought I was invincible. And my journey really didn't take traction until, it was like my late 20s. And I learned that I had a murmur. I didn't know the cause of the murmur. And I knew that a murmur was a sound, but the doctors didn't seem to be concerned, so neither was I. I just went on with my life. So it was really in my mid-30s, and it was during a checkup that, and it was a checkup because I had some signs, I guess, looking back, and I had some like liquid buildup in my lungs, and I had a little puffiness around my ankles, and the doctor thought that they would do a more thorough checkup and looked at my heart, and that's when I first learned that I had what was called a bicuspid aortic valve, and that's where you have two leaflets instead of the usual. And I guess the numbers are that about 1 to 2% of the general population are born with this abnormality. And in many cases, it doesn't mean anything, but in some cases, it does turn into a bit of a more difficult journey. And that's what mine was. So I became aware of that in my early 30s. And the first thing the doctor said was, well, you need to shake the salt habit. So I did that. And actually, I found that that made a big difference. So I would encourage everybody just to shake the salt habit if you haven't done. It's an easy way to impact your health, almost as impactful as quitting smoking. But so I did that, and the doctor said, well, just go on about your life and don't worry about it. It may never turn into anything. It may never get worse. And so I did. So I carried on with my life, and I built a family, continued to build a career, and everything was going quite well. And then I had another checkup in my late 40s. And at that point, the doctor said, well, your mild stenosis is not mild anymore. It's now moderate. You have moderate aortic stenosis. And so I said, okay, well, what's that? And they explained what stenosis was. And I said, okay, so what does that mean? And we had a conversation, and they said, well, it will likely not get better, but it may not get worse. So carry on, go back about your life and carry on. And so that's what I did. So I carried on. And I guess the next meaningful thing happened when I was about 15 years later. So I was 54. And you remember on how we used to renew our driver's license, we would flip them over, and on the back, we would fill out a few questions and we'd sign it, and that's how we renewed our license. It's not like that anymore, but it was a few years ago, and I checked off that box that says, do you have any heart conditions? And so I went, checked, and said, yeah, I have heart disease. Well, I learned that the motor vehicles actually look at that, because I was sent a letter that said, you need to see a cardiologist for assessment, or we'll suspend your license. Well, to a young man like myself, and I guess 54 is young, I guess, but I felt that that really got my attention. So I was sent for a more thorough review, intense, and ran a lot of tests. And it came back saying that I now had severe aortic stenosis. Also a AAA, which is an ascending aortic aneurysm. So that really got my attention there. So that led to a more tests. And I remember saying to the doctor, well, does that mean I can just ignore that and carry on with my life? And this time I got a different answer. I didn't get the, yeah, carry on and we'll watch it. I got the, no, we need to do an intervention. Well, guys, I'll tell you, that got my attention and my whole world changed that day. I can remember the conversation well. I spent a lot of time learning about valve replacement, doing my due diligence. I wanted to learn about the whys, the what ifs, what are the different treatments, and we all do our own version of due diligence. I think I did a fair bit because I had to make some decisions. And I didn't have to make them right away, but I had to make them relatively soon. And one of the big decisions is regarding your valve. Are you going to go down the road of a mechanical valve or a biotissue valve? And without getting too detailed into that, I decided on a biotissue valve. And because of the aneurysm, I was going to have a surgical replacement of the valve. So that was scheduled in the fall. Now this was springtime, so I had a fair bit of time. I had the whole summer to do a lot of reflection. And let me tell you, when you get news like this for any type of major serious surgery, you do a lot of reflection, a lot of walks in the park, a lot of walks in the woods, and a lot of reflecting. So I did that. And you also do things like getting your affairs in order. So I updated my will, the power of attorney, healthcare directive, all of that sort of stuff, just in case. So you may find on your journey that you get in touch with spiritual issues. You reflect on whatever helps you through the difficult decisions, and you do that. So I was ready and for surgery when it came, and my surgery was scheduled in September in the fall, and I was what they call asymptomatic. So I felt good. I didn't have any of the symptoms you sometimes hear about with people who have severe aortic stenosis, other than a little bit of fatigue and shortness of rest, which I thought was old age. But I still, I played around at golf the weekend before my surgery, and I felt fine. And when my surgery was complete, because my journey really wasn't all that exceptional or extraordinary, it was, I was fortunate because of, I was on the younger side of people who have these type of surgeries, to expect a good outcome. And I was told that I would have a good outcome. I did have a good physical outcome. And I did all of the good patient tasks that I was asked to do. I put up with poking and prodding. I was a pin cushion for testing. I did the rehab and learned all I can to be a good participant in my journey. But so when I left the hospital, which was about 5 days, and just to quickly go back, Lorraine mentioned that sometimes patients don't recall being in the ICU. I do. I recall waking up right after the surgery. I recall conversations with the ICU nurse. I recall, the journey on the gurney to the regular recovery room. And I recall all of that. So in my case, I think I remembered most of that. And I'll quickly sidebar. One of the first things I remember after I came to from the anesthesia was they handed me a phone, and I said hello to my wife and daughter, who were waiting for 5.5 hours while I was asleep on the table. But let me come back to the recovery. The recovery went well. As I said, 5 days I was out of the hospital. I was home. I walked out the front door, and I felt reasonably well, considering your chest is opened up, and a freight train ran around inside and was closed again. I actually felt much better than I thought I would, and the incision was a lot smaller and than I expected. What I didn't expect was that about 10 days after I got home, I got hit by the anxiety stick. And Lorraine and Jacqueline referred to the mental side of the journey. And I am told that in the neighborhood of 75 or 80% of people who have this type of major surgery do impact either depression or anxiety. And in my case, I'll share with you, I had no depression, but boy, did I get hit with the anxiety stick, and I did not know what it was. I wish I had the opportunity to be prepared for that, because I didn't know it was anxiety. I didn't know what that word meant. All I knew is that I was in trouble, and I had to climb out of a deep valley of pain. I was not able to walk 10 days after I walked out of the surgery. But I was able to learn through some due diligence and a little bit of Dr. Google. I was able to learn a little bit about some of the techniques to deal with anxiety, and I was able to climb out of that valley of pain. And fast forwarding a few more weeks, it was actually 10 weeks post-surgery. I was through that valley and back on track and back to work. Now, my work was not physically difficult, so I was able to return to work, and in 10 days post-surgery, and I was on a positive track. I had, by all measures, a very good outcome. And I was astute enough to try to marker all of the emotions that I went through during that journey. And I was left with a lot of gifts. And I want to explain what I mean by that in the next slide. The gifts of the journey. At the very least, the gift of health. You know, folks, the doctors and nurses literally opened me up and put sand in my hourglass. And they are really, truly angels. And I really appreciate that. So I want to share with you some of the lessons that I learned on this journey, in hopes that it helps you just to marker a few things to give some thought to as you contemplate your own journey. And that is, you should expect, in most cases, a very healthy outcome. This is very serious surgery, but the success rate is really good. The other thing I would encourage you, ask a lot of questions. You know, just there really is no bad questions. Ask even the questions that sound silly. They've heard them before, but ask all of the questions, and I would encourage you to do whatever you need to do from a due diligence point of view. Learn as much as you can about your procedure. Get a clear diagnosis about what it is they're going to do, and then go online. There's lots of good websites out there. There's hospitals that produce videos. For example, the Mayo Clinic has lots of really good videos. Do smart Googling. Be careful with Googling because you can go down some dark roads if you're not Googling smart, but there's also lots of good information available online. Visit the sites such at patient advocacy groups, sites like ours here at Heart Valve Voice Canada. There's other good sites, Heart Valve Voice UK, Heart Valve Voice US. They have videos and patient supports on there as well that are really useful. There's lots of supports out there. There's another one called heartvalvesurgery.com. This is one that is set up by a gentleman named Adam Pick, who is a patient just like you and me. And so he interviews healthcare professionals from our point of view. So another thing that I would like to leave with you and encourage you, please, please follow the medical advice. Follow the advice from the nurses, the doctors, because you hear sometimes people don't always do that. I did that, and I found that they've been there, they know, they all are very helpful. And my best advice, follow the advice that you get from medical professionals. The other point I'd like to encourage you to do and share with you is identify your supports and your supports within your family, your friends. And I mean by that is supports by who's going to help you drive to your appointments. Your friends are important as well. I had a friend of mine, I just have to put a shout out for my friend Wally, who came to me when I was in that dark period dealing with anxiety. And at the point when I felt I couldn't even get up out of the chair, Wally came to me, and he was a former patient himself, and he says, you and I are going to do the Manitoba Marathon in June. And I said, Wally, I can't even get up and walk to the bathroom. And the marathon was a walking marathon. And he says, we're going to start right now. I'm taking you, I'm going to pour you into the car, and we're going to go to Tim Hortons for a coffee. And he got me moving again. And he was one of the supports that I found very valuable. So Wally and a few other folks of mine, we call ourselves the Zipper Club because of the incision. So we supported each other, and I'm very grateful. Hospitals are a support. They have lots of resources. Your workplace can be a support. If you're in the workforce, talk to your HR people. I mentioned I'm a retired HR professional, but if you have workplace medical benefits, or if you have a private group medical assistance, look at your EAP plan. There's lots of supports that are available there. And of course, your spiritual or your community supports. But bottom line is identify your supports. One other quick one is respect the mental impacts. And that is, as I talked about earlier about depression and anxiety, don't discount that. It is serious, it's common, it's normal, and it can be dealt with. The thing is, it's not always obvious what is going on while you're going through it. So respect your mental impacts. One of the final things I'd like to share with you, this is my journey, and my journey is not over, it's continuous. It's a lifelong journey. You will have your own journey, but recognize and appreciate the guardian angels that appear throughout your journey. And what I mean by that, that's that one nurse that goes over and above, the one that advocates for you when you need it most, and they will be there. Recognize and appreciate them as they go along the way. And finally, embrace the gifts. The gifts are yours, and they're personal. For me, gifts were things such as perspective and self-awareness. The gifts of recognizing and embracing your own mortality. The gift of service and charity work. For me, the gift of service led me to be here today as a founding member of the Heart Valve Voice Canada is to share my experience and to advocate for patients that are dealing with heart valve disease. But I suppose if I reflect, the two gifts that's really stood out the most for me were the gift of gratitude and the gift of humility. So folks, I'm going to leave her there. Thank you very much for joining us today for this webinar. I hope that this was valuable for you. It was good use of your time. And I wish you all of the best on your journey. Goodbye.
Thanks, John, for sharing your very personal story. It was tremendous for you to share it. And Jacqueline and Lorraine, thank you for sharing your wealth of information. I'm sure anyone that is moving forward with valve treatment will find all of that information very helpful on their journey. We just wanted to talk a little bit and touch base on the resources that are available that you have all spoken to. There are resources at the hospital or clinic that's performing your treatment. Also to go to Heart Valve Voice Canada, as well as there's a Heart Valve Voice in the UK and the US. The Heart and Stroke Foundation of Canada as well has information on valve disease, as does the Mayo Clinic. And for anyone that's finding themselves in a crisis situation from a mental health perspective, again, there's a toll-free number as well as a text number for you to reach out and get help that you need. And Anxiety Canada has an app that you can get off their website at anxietycanada.com, and it's called Mindshift CBT, as well as an app called Insight Timer that can help anyone from a meditation perspective. And at this point, I would really like to thank all of our supporters who make all of our work at Heart Valve Voice possible. We thank them for their ongoing support. And finally, once again, please go to our website at heartvalvevoice.ca to find resources and information and more about us. Thanks very much for joining us.